And of course, as case numbers are going down, the vaccine doses are going up, the concern about a fourth wave continues to be debated, talked about as we learn more about this Delta variant. However, experts say that the urgency for second doses can stop that spread. So we need to know what kind of testing needs to be done in our labs. Michelle Hoad joins me now, CEO of the Medical Laboratory Professionals Association of Ontario. Michelle is in Hamilton, Ontario today. Good to see you as always.
Good to see you, Angie.
A lot of questions. And I mean, if I look at Ontario, where you are right now. Low numbers today, 744 cases in Ontario, tragically 24 more deaths. Testing, though, at 27,000 or so. At one point, we had testing at 72, 73,000. So there's that major fluctuation there. What's the situation in the labs right now?
So just in conversation with a lot of our labs over the last 2 weeks, they have been telling us that the number of COVID tests coming into our labs, specifically from assessment centers, is dramatically low. So that is tremendous news. So I think when we see that low number, it's not that tests aren't being processed, it's that the ones coming in, actually there aren't that many.
What about now when you are testing? What are you testing for? How much are the variants playing a role in that, as now we're trying to track the B117 variant? That was one that we were keeping a very, very close eye on. My understanding was testing was being done around that variant. What about the Delta variant?
So the great news is that with the decrease in COVID testing actually frees up resources to do more of this genome sequencing testing, which is what we're referring to. So public health has advised us that they are now looking into all of those variants and taking a look at, what's the impact of that. So the little reprieve we have now is actually going to help us, give us a lot more information as to what's happening with these variants.
Does more testing need to be done, do you think, or are we seeing it not necessarily the numbers as high because more and more people are getting vaccinated?
It's a really great question. I think when we look at our entire toolkit that we have, we know that the PCR test is the gold standard test. But, Health Canada now is looking at introducing a new home test that you can do within your own home. That will be another tool that we have. Hopefully, we will see that in our rotation in the next few months. But, of course, the more people that get tested, if they need to, is important. I think one thing I would caution us is we don't want to get tested just to get tested, because, again, that's going to be a waste of a test. Remember that we also have limited resources that's doing that testing, so we don't want to put strain on the system that doesn't need to be there. But the behavior we have been seeing, especially in Ontario, is people are following protocols. If they have symptoms, they're getting tested, and everything seems to be going the way it should right now.
What would your advice be then, as you say, as we're moving forward on this, hoping to get to that new normal, when we start reopening the border, for example, allowing for more travel, even just locally, reopening up schools, having more people indoors? What would the advice be there?
I think we need to still tread carefully. I say that until you are double vaccinated and you wait, the period of time that they're suggesting, which is 14 days, I think you need to proceed with caution. I think we want to all get back to as normal as possible, as quickly as possible. But I think what we've learned in the last 6 to 8 months is if we move too quickly, we're going to take, 2 steps forward and 1 step back. Let's just all be smart. Keep washing our hands, keep wearing our masks. I think some of the data right now with the fact that we haven't even seen the flu is proof that masks work. So let's be smart. Let's take the next 60 days. I like to look at it from a 60-day perspective. The next 60 days, let's keep wearing our masks when we need to, keep our circles still pretty tight. Then hopefully by September, October, things will look very different.
I hope so too. You and I are having a much different conversation then. Michelle Hoad, CEO of the Medical Laboratory Professionals Association of Ontario. Stay safe, Michelle. I'll talk to you again soon.
Have a good day.
You too.